Hey, what's going on, guys? It's your boy Kevin Yee, the Farm D. Now, a lot of you guys are probably wondering, well, what other careers are there outside of hospital and community pharmacy? One of the avenues is managed care, and today I actually interview a managed care pharmacist. Um, so we talk about the basics of it, what it's all about, how this pharmacist particularly got into managed care, and if you're in retail, it's probably one of the easiest ways to leave community pharmacy. If there are specific questions, we can do a part two. Let me know in the comments below, and we'll do a part two and answer your questions specifically. Meanwhile, sit back, relax. This is a long interview, so just take your time with it. It's not a 5-minute type of video. Listen to it all the way, and you might see, maybe you're interested in managed care pharmacy. Anyways, guys, I will talk to you guys later. Take care. Peace. Start recording.
Okay.
And basically I think it's really cool just to have I just really want to share your story, because I'm sure a lot of people are trying to escape like retail pharmacy and they want to know other careers in pharmacy. So what better guest than to have the managed care pharmacist. We just came up with that name just now, literally. But I thought it'd just be really, really cool. So yeah, why don't you tell us a little bit about what you do as a managed care pharmacist, and let's go into your history, man. Let's go into like schooling and all that. Let's get into your story. How's that sound?
Okay.
Cool. So just in like a short sentence, what does a managed care pharmacist do?
So there is a very like broad area of pharmacy that I think a lot of people don't know about. So in the day to day, they have a very different job than anybody could imagine. Um, but in general, they manage the health plan for the members. So that involves a lot of formulary management where they create the drug list that most people have. That is what. Sorry, let me just start over.
It's all good.
Because
No
I'm
pressure.
trying to. Because when you said summarize in one sentence, I'm just like
My
it's
bad. Maybe I
very
shouldn't have said that. Why don't I just rephrase it?
yeah.
Let me ask you, what does a managed care pharmacist do? And let's paint the day to day, and we'll start off there.
Okay, so um, most managed care pharmacists work for health plans or PBM, which is pharmacy benefit managers. Do you understand the difference between the two?
Why don't we explain it to the audience, man?
Okay, so pharmacy benefit managers are the ones that do contracts with um, pharmacies and health plans, and they also do contracts with drug companies to negotiate for rebates and drug pricing for different drugs that are on the market, or and then they help the health plans get the best price for the drugs, as well as making sure that, say, if the health plan wants to have certain drugs to be preferred versus non-preferred, then they are the ones who put in the infrastructure into the retail pharmacy to help block certain things from going through. So the job of PBM is very complex, but that's just in a nutshell. That's basically what they do. They basically at the service for the health plan, they do whatever that the health plan wants them to do. So the few big key players are CVS Caremark, um, Optum RX. So if you ever have like a card, your insurance card, it'll say the insurance company's name, but then in the back of the card it will say CVS Caremark, and then you're like, wait, so is my insurance CVS or is it something else like Anthem, for example?
Anthem, are we talking about like Humana and stuff like that
Yeah,
too? And
yeah.
Aetna? Yeah,
So
gotcha.
Humana sometimes will have like, I think Humana has CVS Caremark. No, actually Humana
No,
has
they
their
they
own
they got
Yeah.
acquired recently. I think by Walmart, right? Was that the case? I don't know. I'm kind of off with my pharmacy news, man.
Um, I don't think they've gotten acquired yet. They were about to be bought by Aetna, but then Aetna was bought out by, I want to say,
Aetna announced that it would acquire Humana for 37 billion.
yeah, but I don't think that went through.
Mm, 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 mm. Well, whatever. We have a bunch of names for like the key players and stuff. That's cool.
Yeah,
Um,
yeah.
yeah, that's cool to
So
see.
that's why when you get your insurance card and it will say CVS Caremark on there, but CVS Caremark is just the pharmacy benefit manager and it's not your insurance company.
Mm,
And then insurance companies, which is what I'm working in, they basically help design the entire um, plan for the member. So there are different types of insurance companies. There's Medicare, there's the ones that do Medicare, Medicaid, um, commercial insurance, and then there are also health exchange, which is for people who are self-employed, and they can't get the insurance from like a commercial plan, or and they
mm,
also don't qualify for Medicare or Medicaid.
mm.
And then there might be more than that, but those are the ones that I'm familiar with the field that I'm in.
Awesome, cool. So why don't we just go into your like pharmacy journey, man? I would love to just hear your story and see how you got into this field. So let me ask you this. How did you what got you into pharmacy? Kind of curious about that.
So I have a few family members who were pharmacists and when I was getting into high school, and I was hearing like them getting out of school and getting big bonuses, and it just sounded so like at the time, like as a high school student, I thought it was gonna be something that I'm gonna get out and make a lot of money. And then I was working as a cashier when I was around 16 and at a Kmart. I don't know if you're familiar with it.
Yeah, I am. Yeah, Kmart. Yeah.
Yeah, at the time it was still around. And so I was just a cashier and I heard that the pharmacy was hiring to pharmacy technicians. So then I signed up and then I got the job. So I worked as a technician for about 3 years.
Mhm.
And then I realized I actually really liked it and I was pretty good at it too.
You really liked it? What did you like
Yeah,
about it?
I did. I really liked it actually. I don't know, it's just a lot less responsibility. Kmart was also a really small store,
Mhm.
so I felt like it was not as crazy as Walgreens. So luckily, I've never worked as like a really like high demand store like Walgreens, CVS. I've worked at pretty small stores
Mhm.
for the most part. So I feel like I was able to build a rapport better with the customers or patients, I should say. And I was able to, actually enjoy my job, not just, trying to meet the numbers and trying to fill so many prescriptions a day and things
Mhm.
like that. So,
What parts did you kind of enjoy during that time?
I definitely enjoy the patient interaction. I mean,
Mm,
as a technician, I couldn't really do much, but
yeah.
I really liked the patient interaction. And I was also, I felt accomplished every day when, we have like so many, we have like a really busy day, but yet I was still able to get everything done and I was quick at it. Um, so I thought to myself, like, this is something that I can see myself doing for
Mhm.
a long time. So I I ended up doing pre-pharmacy in undergrad for, I took 2.5 years just to complete all of my prerequisites for pharmacy school. So I pretty much after I graduated high school and started undergrad, I knew that this is something I wanted to do. So I didn't really try and pursue a bachelor degree or anything. I
Mm,
only did 2.5 years, got it out of the way, and then applied for pharmacy school. Um, and so like this whole time I have this preconceived notion that I was gonna become a retail pharmacist.
yeah.
And then so after Kmart sort of disappeared, I ended up like getting jobs at two other pharmacies,
Mhm.
and some of them were a lot busier than Kmart,
Yeah.
but I still liked it. I still felt like I could see myself doing this, but over time it just started to wear me out.
Mm.
And
What
I think,
exactly wore you out, I guess?
I'm sorry,
What exactly wore you out?
like just there are just long hours, and there will be days where I feel like I only pee like one time, or I don't even have time to eat because I'm like extremely busy and I keep running around all the time.
Yeah. You know what's so
Uh,
funny? That's like a common complaint between like like with us like retail pharmacists. We always talk about like, dude, we can't even step up for a pee. And I really think that's like a serious problem, man.
yeah,
Like
and I also had, I guess I had bad management, and that was
Mhm.
one thing that kind of pushed me to pursue other area in pharmacy. At
Mhm.
the time, I was just so invested. I like had this whole trajectory of where I want to be. So I didn't want to switch career. But yeah, I
Mhm.
just wanted to find something that I like more. Um,
Mhm.
but yeah, like I had pretty bad experience with one of my bosses. Um,
What exactly
she
happened?
would she would make me come to work whenever, like, because I wasn't, at the time I was working as a technician, and then I became an intern at that same store once I got into pharmacy school.
Mhm.
But every time she would be short on staff, she would call me in, even though I have like exams to study for, and on days I'm not scheduled to work. And then when I needed to take a day off because I was sick, she would get really mad about it, and wouldn't and would say things like, "Oh, people go to work and while they're sick all the time, so I don't see why you can't do that."
Mhm.
Um, so that was kind of why I just like, I see why she treated her employees like that, because otherwise the pharmacy would just not be able to get their things done. But I just don't want to be in that environment where I feel like it's all about production and there's no emphasis on really doing the really good like patient care. You know what I mean?
Yeah. Yeah. It sounds like the like why you initially went in was just because you wanted to really impact and have more hands-on patient care and rather than just like hitting the numbers and all the business metrics and all that sort of stuff. And that's kind of like what you experience, right? Is that something I'm is that what
Yeah.
it sounds like? Yeah. Cool.
Yeah. One of the pharmacies I worked at actually, they they actually mandates patient counseling. So any time that anyone picks up a new prescription, you have to counsel them
Mm,
on the side effects and monitoring and stuff like that. And so I actually really like that part of the job. But at the same time, they also want like the certain number of MTMs to be done in a
mm,
day, certain number of flu shots. I mean, as most of you are familiar with. Um, but I just don't think I wanted to do that long term.
mm.
Um, Especially the MTM part. I don't know how you feel about it, but I am very against MTM.
Why is that? That's interesting. I'd love to hear your perspective on that, man. Because I feel like a lot of people are like pushing MTM and like when I was working corporate pharmacy, they were all pushing that and just saying it's the future. And even a lot of the pharmacy schools back in the day were saying that it was a huge thing. Like I'd love to hear your take on it.
So it's a great concept. You take somebody's medications and you go through it with them and make sure that you identify any areas of inappropriate utilization, and you help uh, address any concerns that they have. And so it's more geared towards the Medicare population, right? That's what MTM is designed to do. However, there's just a lot of flaws with it. And now that I'm working in a managed care setting, um, we spend so much money on MTMs every year. So my company alone spends over $30 million on MTM alone every year. And bigger companies like Humana probably spend even more. So there's just so much money being poured into MTM, but at the same time, there's just not a lot of benefit that I think comes out of it because of the fact that MTMs are mostly done in retail setting where pharmacists are so busy trying to fill, a high quantity of prescriptions every day and having to do flu shots and having to fit MTMs into that. So every CMR or session that is done with patients is usually, I don't think if you, because no one has ever like measured quality for those CMR sessions to know how well they're done and how it benefited the member. Because I've never seen any study that was really done to assess the quality of those CMR sessions. And so most of the time they're done just to be done, but there's just not much benefit of doing it. So
Yeah, it's pretty interesting. I actually quite agree with you about all that. Especially as someone who was in the retail setting, who was doing CMRs, and was doing like tips and stuff like that. Like, I always wondered, like, it was a great concept, right? Of really taking the pharmacist to the next level and trying to differentiate like the 1950s pharmacist versus the modern day pharmacist, right? Because
right.
were underutilized. So it was a great concept, and I think it was great intention. But like a lot of things in corporate pharmacy, or like even retail pharmacy, like the execution behind it, I always question like kind of the quality of the services that we are providing, right? Because we are always constantly busy and stuff. And literally the only time I could ever really do a really comprehensive like review was when I had another pharmacist like taking over, and still we were bombed all the time, right? And
Yeah,
it just became like
exactly.
another checklist item, which was like it's tough. And I know my store, it was busy, but it wasn't like crazy busy like compared to CVS's of the world and Walgreens and some of the major chains, right? So I really do wonder, like, I think you bring up a great point, is like, dude, you guys are spending 30 million per year on these services. Like, where is it actually impacting patient outcomes? You know what I mean?
And another part of it is like sometimes what MTM really is tracking all the things that you do as a pharmacist, right, in order to get reimbursement.
Yeah.
And that in itself takes up a lot of time. So I feel like some pharmacists don't really like doing that because it's like they have it to report what they do as a pharmacist. So for example, say if I see somebody bring in a prescription for an inhaler like ProAir that the insurance doesn't pay for. So I would automatically call the doctor and get it switched to something like Benylin, right?
Yeah.
That is covered. So I just do it. I just do that automatically without, thinking about, oh, this is something that can be reported as an MTM opportunity to get paid. So I think things like that is in the pharmacist's job to be able to identify those things and do it. Now insurance companies are reimbursing for these things, which sure is an additional cost, but is that necessary?
Mm.
If you know what I mean. And then the pharmacists have to go in and report it, and then they get paid tons and tons of money for every time they do those things. And then the pharmacies are the ones that reap all the benefits. It's not the pharmacist that gets that, that money. It's more the store.
Yeah.
So I think it's just where it's just an area where I feel like it could be saved and not have to do those tips.
Mm. Yeah, and I see where you're coming from, and I do see like kind of like the corporate pharmacy like coming in, like their perspective and being like, well, we're offering these services. They shouldn't be. If we're offering these services, well, it is of value because it helps get the medication to the patient is a win-win for all parties, right? But I do agree with you on the fact that, that is a conversation that needs to be more transparent about how do pharmacists get reimbursed these days, right? Because there's so many, it looks like a back and forth war right now. Like there's DIR fees and all these all these like interesting. It's interesting to see how the billing has changed even within the last like 4 years now.
Mm-hmm.
Really, really interesting. um sure, I guess we could keep on talking about MTM, but I'm kind of curious. So like, why don't we go back into your story for a second? We can talk more about this later. But yeah, let's go back into your story for a second. So you graduated pharmacy school, you worked for two other pharmacies, you didn't like the management. How did you end up deciding like, hey, managed care was something for me?
So I so during pharmacy school, we took this class called um, careers in pharmacy, and one of the careers that came up was managed care pharmacy, and I had never heard about it before prior to pharmacy school, because most of the people that I know always end up going to retail or hospitals. So those are
Yeah.
the only two areas that I'm familiar with, that I was familiar with at the time.
Yeah.
And so they brought in like the speaker who works at Humana, and he would tell us about all the things that he does. And I just thought it was the coolest thing I've ever heard. Just a quick piece of information. He worked, he worked in a very specific niche of managed care, but what he does is he he looks into the pipeline and see what drugs are about to come out
Mm.
onto the market, and then he works within like a team to project what impact that drug will have on the health plan, such as how many people probably be eligible for it, how much the health plan will have to spend, what are the criteria that we need to start implementing in order to make sure it's being used appropriately. So I just thought it was the most interesting thing I've ever heard. So
Dude, I wouldn't be surprised if this guy was also investing too, because that's like pretty much what you do
yes.
when you're investing in
So
something,
then
right?
I ended up like getting involved in AMCP, which is the Academy Managed Care Pharmacy.
Mhm.
And then I just did a ton of research into this area. Like I talked to pharmacists, I
Yeah.
shadowed managed care pharmacies, like the big health plans that were available in my area. And I would encourage anyone who is interested or even like remotely uh, interested in managed care or just wants to know what it is, just try and shadow one of the pharmacists.
Let me ask you this. Like, I think this is actually important. Like, how did you go about asking for that opportunity right there? Like,
I
what's the process?
honestly, I just walked up to him and I asked if I could have coffee with him and kind of chat about his day to day. And for some reason, like out of all the pharmacists that we had, it just felt like his job wasn't very stressful because he was available to see me anytime.
Yeah.
Uh, and and then after that, he just kind of became my mentor. And if I ever needed anything, like he wrote my letter of recommendation for residency after. And so
Mm. You
it's
still
all
keep in
about
touch with him?
networking.
Oh,
Yeah.
you still do? Awesome.
But so yeah, after that, I ended up doing a PGY1 and managed care pharmacy. It was it's a Medicaid plan that I decided to go into.
Mhm.
And so after PGY1, they offered me a job. And so I've been a pharmacist with the plan ever since.
Mm. That's cool. I'm kind of curious. What kind of things do you do at what kind of things did you do during your residency?
So we have different rotations that we would do. It's kind of like, so for me, my PGY1 felt like the last year of pharmacy school. So
Yeah.
I would have different rotations. So one rotation would be in formulary. So formulary is basically where people would design like
The list.
what drugs are preferred, what drugs are non-preferred, and then communicate with the PBM to make sure that those are put in place. So that's, a quick description of formulary, but it's very, very complex. They also have meetings with the drug companies and to be able to make those decisions as well. And then I
Yeah. And
have
are you like in formulary, are you also like reviewing a lot of different like studies and stuff too to determine whether it's formulary versus non-formulary, or is that
a little bit of that
okay?
also, but for like a day to day, there's a lot of meetings going on. So meetings with people, upper management people, to make certain decisions, going to pharmacy and therapeutic meetings or P&T meetings. I'm not sure if you're familiar with that.
Yeah, I am. But
So we go to those meetings and then we propose these drugs and changes. So if we want to make certain things preferred versus non-preferred, then we would present that information to P&T, and then we'll have like different members of the P&T team that make decisions on those things. Um, so basically just managing the formulary. So I did that for the majority of my residency. And then we had a rotation in prior authorization. So these are the frontline pharmacists, I guess, for a managed care setting, where any PA that is sent in through retail, that they would they would make the decision whether to approve or deny. So these people only use the formulary and the policies to make these decisions. So they're not the ones that create the policies or create the formulary, but they more like execute the formulary and the policies.
mm. Do you ever I just a random thought, do you ever see that kind of being automated in the future?
What do you mean?
Like, because if they're not the ones making the decisions about like the policies and stuff, like is it basically they follow an algorithm to kind of like come up with their decisions, or like tell me about that
We
process?
do. There are some automation going on. So, like, for example, if something is only appropriate for certain diagnoses,
Mhm.
then the PBM will help put that automation in place. So if you submit like a certain diagnosis code, it'll just automatically approve. But the PA pharmacists are still important for things like we need to use our clinical knowledge for.
Yeah,
So
gray area type of.
we'll make decisions based on like clinical knowledge and not necessarily like exactly what the policy says that we
Yeah.
should do. And then there are also other things where it's not just the algorithm, but you also want to see evidence. So like say if the doctor might say, oh, this patient has tried X, Y, and Z, but then
Failed.
they might not have done it, or they might just have had like samples. And so you want to see that they actually really tried it for like 3 months or more.
Mm.
So there's just a lot of like different nuances that go in that where it requires the pharmacist to be able to make that decision.
That's pretty interesting though. Like, yeah, I've always been kind of curious to see how the because I can imagine how many like PAs are being sent over to being sent over, right? And
Yes, it's
how
a
does
lot.
that all get managed? So it definitely is not. I definitely would assume that it's not 100% manually reviewed. There has to be some sort of automation. But it's kind of great to hear that hey, there is automation, but then like for more of the gray area cases, like a pharmacist definitely needs to review that. That's awesome.
Yes.
Um,
So I am actually a PA pharmacist right now.
mm,
So I do that pretty much every day, 5 days a
yeah,
week.
yeah,
Um, and I really like it. I think it definitely opens my eyes to what, these people do, because when I was in retail, every time a PA came up, I just felt frustrated, like, why can't these people approve these drugs? Or I don't know, I put a lot of blames on the insurance companies, but now that I'm on the other side, I definitely do appreciate what they do, because there are times where doctors would, prescribe certain things that they shouldn't have prescribed. I'm sure I don't know if you've seen that before, but like
Yeah, all the time.
they would prescribe stuff that either are duplicate with something else, or they prescribe something that are way too expensive and there's a cheaper alternative.
Yeah.
Things like that. So yeah, I do that right now. And let me tell you a little bit about my day-to-day, I guess. So I work from home right now. So that is one nice perk about PAs, I guess, is most people can work from home. And they don't have to be in an office, because all they do is just review cases on a day-to-day basis. So that does give a lot of flexibility. So I can sometimes have like my own schedules. Um, and I still have patient interactions, in the sense that if I needed to get like further clarifications on why these certain things are being prescribed, then I can make phone calls out to people, or doctor offices, things like that.
Yeah. That's cool. So like I guess like paint me the picture sort of like how many hours do you typically work a week then?
40 hours a week. Sometimes I might work more depending on if it's like a really busy week. So kind of like retail, where if it ends up, having a lot more work to do, then we would work a few
Mm.
extra.
Compared to retail, how is like compensation and stuff? How is the pay compared to retail?
It depends on the health plan that you're with,
Mhm.
but with mine, because it's nonprofit, it's a lot less
Mm.
than retail.
Yeah.
However, the way I justified it is I get really great benefits
Mm.
working for a health plan. So most people start out getting at least 4 weeks of vacations. And I think that's pretty typical for a lot of insurance companies, not just mine. Um, and we also have, it's pretty low stress, I will say, compared to retail.
Yeah. Sounds like it.
So it's really worth it.
Let me ask you, like, out of like let's give it a range. Like if somebody was to work for a for-profit, what is kind of like the range for a pay scale usually for that?
The range will probably be comparable to retail.
Okay. Gotcha.
Yeah,
That's
for
cool.
sure. And then there are company bonuses and stuff. So if the company meets the metrics, or if that person's performance meets metrics, then uh, there's always a bonus systems between like 10 to 15% of the salary,
Mm.
or higher in certain places. So
Bonuses, like what kind of like how do they assess your bonus, by the way? Is it based off
based on like metrics, money saved, total money saved for the health plan.
Mm.
And I'm not entirely sure how they do that calculation,
Yeah.
but for PAs, they just see, like, they usually assess by the number of cases that we do per hour. But then for formulary, it's more like, oh, if we um, decide to put PA criteria for this drug, then how would that change utilization? And then
Mm.
they calculate how much money is saved from
Mm.
doing that.
Gotcha.
So that's
um
just one example.
mm. Now I'm kind of curious too, like you painted some of the benefits and stuff, but how about the other side as well? Was there anything that you kind of unexpected, like that came unexpected to you, or some of the things that I don't want to say weren't so great. That's not what I'm trying to say, but some of the like I guess challenges being in managed care.
Um, so it depends on where you work in managed care, because like I said, there are a lot of different areas to go into. There are people who their day-to-day is very interesting. They have different things going on every day. There are days where they're in meetings. There are days where they meet, they are traveling, talking to different drug companies, going to pharmacy dinners, things like that.
Yeah.
But then, uh, so for me personally, being a PA pharmacist, my day to day is very much the same. So I just review cases. So there's that monotony where it can be pretty boring sometimes. Um, and another thing is I feel like I'm not in the position to make a lot of decisions. So if I get passed down certain policies or criterias, and there will be time where I don't necessarily agree with them, but it's hard for me to make a decision because everything has to be worked up the management ladder. So sometimes certain things might be implemented and changed from like somebody speaking up in my level, and then other times it's harder. So,
Yeah, kind of curious. What does the hierarchy kind of look like, by the way?
so staff pharmacists like myself, and
Yeah.
then there's, it's kind of like any company that you've been in. So I say it's more similar to the corporate world. So there's staff, and then there's managers, and then directors of a company.
Okay.
So that's pretty much what it looks like. But in terms of like different areas, then everybody is about the same level. So there are people working in formulary, there are people that do PA, there are people that work in more clinical settings. So they would write policies
Mm,
and things like that. So
cool. Are those pretty much the major departments within managed care?
there's formulary, there's people doing PAs, there's people who write policies for different types of drugs. So there are people who are specifically would just write policy for cancer drugs.
Mhm.
There are people that only write policies for different biologics, things like that. And then there's people who help design the MTM program. So they're the ones who determine what tips are working, which ones are not working. They meet with retail um, uh, district managers just to discuss how their retail companies are doing, things like that. And then there are people who some of the jobs is really hard for me to explain because they do so many things. Um, but those are just the main ones that most health plans would have.
Yeah. Kind of curious too. Like you said, when you're working, I really want to revisit this because it's pretty interesting. One of the things that you said that when you're working retail, you would have like a lot of frustration toward the insurance companies and stuff like that. But when
Yeah.
you started working for managed care, you had some realizations. What were some of those realizations that you had? Like,
So
or appreciation. Yeah. Sorry. Were you gonna say?
so I will say that since I work for a nonprofit organization, the whole goal is always to save money. And the money is actually the American tax dollars that we're saving. And so the whole idea is not, oh, we want to put a lot of restrictions in order to prevent our patients from getting the drugs that we want. The mindset is it gets shifted for me. Is like we're that the health plans are putting all these programs and restrictions in order to help save money for in the long run, and then we can utilize the money for other things. So we don't just design formulary and execute the formulary, but it's more we create programs such
Mm,
as and then we do like community programs in order to help people. So for example, we'll have like opioid programs, or we have certain programs are put in place in order to make sure that the member stays healthy rather than needing medications,
Yeah.
things like that.
Yeah. Do you feel like yeah, and I always kind of knew that too. Like, hey, there's these certain things in place to save on spending. But do you ever feel like and like through I don't know, I wouldn't say history. I like I don't want to sound that old, but what I've realized the trend is it's almost like a pendulum, right? And I think in the past it was the pendulum was way too far on the pharmacy side. But where do you think the pendulum is nowadays, like right now in the current state of pharmacy?
Say that again.
Like what do you think like the system favors? Because what I'm running into, like what I was running into a lot near I guess like before I left retail pharmacy was that it really seemed, and 100% I was biased, but it really seemed like it was like in the insurance favor, because like I remember like I remember going up and doing all this research on like DIR fees, and they were so mysterious and no one knew what the hell they were getting billed for. You know what I mean? So that's why I was saying, like, do you think it's shifted? It would like, where do you think the pendulum is shifted more toward the PBM side, or is it more toward
Oh
the
yeah.
retail pharmacy side right now in this current state?
Um, so I'm not sure if I understand your question fully, but are you saying like who's the one making the who's reaping the most benefit? Is that what
Yeah,
you're
I kind of like where do you think the pendulum is falling in favor more toward? Like, is it toward more the insurance companies or the actual pharmacy side?
I don't think it's the pharmacy or the insurance company. I think it's more uh the 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 ones that um it's kind of hard for me to speak about um because
Well, yeah, and plus you're not really you're at a nonprofit pharmacy, so it kind like
yeah,
a nonprofit, so kind of changes the perspective a bit.
right.
But yeah, that's true.
But I will say that the PBMs are the ones that probably is in the most favor because there are very few PBMs out there.
Yeah,
And so they're the ones who work with so many different health plans and work so
yeah,
many different pharmacies. And so they're the ones who dictate pricing and uh, and all these different things.
mm,
So, like, say if they negotiate with certain drug companies for pricings, um, they're the ones who also get a cut from it.
mm,
And so they will say, well, the insurance company will have to pay us this much in order um, for us to work with them,
mm.
and so I will say it's the PBM, but the health plan, the pharmacies are just two other players in this. So
Yeah. Wow. Okay, so as we're coming up near the hour, I guess, let me ask you something. Let's say if there is a pharmacy student, like someone who is in pharmacy who wants to kind of get involved with managed care, what would you recommend them to do? Let's say it's their P1. They're just getting into pharmacy, they're interested in it, but they don't know what's for them. What's the best advice you have for them?
um, I will say just keep their options open, because there will be things that they run into that they don't expect that they even like.
Mm,
Um, so I will say just try and get involved in as many student organizations as they can afford
mm.
to,
Yeah.
and start with AMCP, which is the Academy of Managed Care Pharmacy,
Mhm.
and go to their meetings. And if the school that that the student is in doesn't have it, then they can always just join the national chapter.
Chapter. Yeah.
And they have a lot of resources on the website. And
Mhm.
then also try to network with pharmacists in the area who worked for a managed care setting and see if they can shadow that person and learn about their day to day and see if they actually see themselves working in that environment. And
Mm,
it is for a very different niche of pharmacists, so they have to also assess their personality and see if are they okay working in a setting where there's not a lot of patient interaction.
mm,
It's more of a project-based setting, so it's not in retail where everything is task-based. It's more of a
mm.
project-based setting.
Yeah.
And there might be jobs where you have to sit there and read clinical trials
Yeah.
all the time in order to determine these policies, or you have to be in a meeting room where with a bunch of people. Are you going to be able to network well and get along with people? So like I think it's really of a personality thing too,
Mm.
to see if that's a good fit.
What kind of personalities do you think would be a great fit for managed care?
It depends again on the area, but I would say somebody who's organized, project driven, who's innovative and can come up with new things to improve on all the
Mm,
time for the plan, and then who's good at time management. I think
mm.
that's huge.
And
Um,
let me ask you this, like, let's say someone is like, man, I really love this. I really want to go managed care. Are there like internships available for like within managed care?
there are a few, there are some, but I think they're limited to certain geographic areas. So
Mm,
they'll have to apply and then see if they can maybe do a rotation at one of those places or spend a summer.
yeah.
I can't think of any on top of my head, but
Yeah, of
there's
course.
also rotations they can do in these health plans as well. I did two of them at two health plans in the area that I lived when I was a P4. So
Mm,
it's definitely doable.
yeah.
So I would say just do rotations, and then I believe that managed care is almost mandatory. There are people who get jobs in managed care setting without a residency, but most likely you would need a PGY1.
Mm, gotcha.
Um, and that will really expose you to different fields of managed care,
Mm,
um, and then be able to find your niche. Starting out though, I feel like most people would start out in a more task-based role, like prior authorization or MTM,
mm,
and then eventually work their way into formulary,
mm.
which is more involved with writing policies and developing the formulary and things like that. So
And let me ask you this, like for people that are stuck, quote unquote, stuck in retail, let's say if they want to go into managed care, is it possible to well, I know the answer to it, but I mean, how would you go about transitioning into managed care if you're a retail pharmacist?
so if you're already a retail
Mhm.
pharmacist,
Yeah, you're practicing right
I
now.
would, I think the easiest thing to do is try to get your foot in the door.
Yeah.
Because with anything is more, networking that you need to, so like just get your foot in the door first with anything available. I think the easiest option again is
Is the whole
doing prior authorizations,
PAs, yeah. Yeah.
because it's very similar to retail, and because you have the retail background, and if you can show that you can meet the numbers and you're really quick at what you do, most companies would hire retail pharmacists without any managed care background.
Yeah.
And then once you're in it, then see what you like and what you don't like and learn about different roles. And then there'll be so many jobs that are available. There are pharmacists that do audits for PA. There are pharmacists
Yeah.
that it's just a lot. So
Yeah, that's awesome. By the way, because I hear that a lot, and a lot of my personal friends have actually transitioned that way specifically. So that's really cool. Well,
mhm.
anyways, dude, I learned a lot on this. I didn't get into your personal story as much as I really wanted to
It's
because I
okay.
work with you, but that was pretty cool. I think it'll give people a good taste. I would love to have you back on, like if you're open to it. I'll probably screen the comment section, see if anybody has some dire questions. I'll pin like a comment being like, hey, what else did you want to learn today, like on the interview that we didn't get to talk about? So yeah, I would love to have you back on, but if you can't, no sweat. But just thank you so much for just taking the time just to talk to me today. I really appreciate it.
No problem.
Yeah. Any
Yeah,
last words that you want to have?
I hope it was enough without being too much
No,
because it can get super complex.
yeah,
And I didn't want to go into like the nitty-gritty stuff of
yeah,
manicure
yeah, yeah. Awesome.
unless you have like a specific topic you want me to
I'm
discuss.
pretty sure this was a good like first opener. You can't dive super deep, and
Yeah,
this is even pretty new for me as well. So I'm actually definitely learning a lot as well. So
yeah.
yeah, it was really great. Thank you so much.
You're welcome. It was nice meeting you.
Guys, what other areas of pharmacy do you want me to cover? Let me know in the comments below, and watch more of my pharmacy podcast. You can watch it right here, or here, or here, wherever the end cards are. Also, make sure to like, comment, subscribe, and hit the bell so you can watch all my pharmacy podcast videos and you don't miss a single one. I will talk to you guys later. Take care. Peace.